This is what you do when you get a letter saying that you were going to have a smear test. So the letter will invite you to have a smear test, and if you haven't had that before, or if you have had it before and you think it wasn't a very nice experience, I'm just going to say what you should do when you get your letter. So what you do when you get your letter is you pick up the phone and you dial the number and you book your smear test. Okay, you don't even wait to think about whether you're scared about it or you'll do it another time. You won't do it another time. You just do it now. Okay, so as soon as the letter comes, you go 5, 4, 3, 2, 1, pick up the phone, make the call. Okay, so that's done. You've got your appointment. You know that you just put it in the diary and don't think about it, don't worry about it. And then on the day of your smear test, you're going to have a nice warm bath so that you're nice and clean for the nurse. And you're going to go and sit in the waiting room, really relaxed, get on with, catching up on some work or some messages on your phone, look through a magazine. You're just going to have a nice quiet time. Your life's probably quite busy, so while you're sitting there, it's 5 minutes of calm. You don't need to think about the smear test because that hasn't happened yet. You're going to be in the moment. And then once you get called through, it's going to be a nice lady. People who do these things are generally, they're used to dealing with people who might be a bit anxious or who might be a bit squeamish and all that sort of thing. They're used to people who it's the first time experience for them, so they want to make sure that it's as painless as possible. Oh, I should have said as well, before you go to your appointment, if you're worried about being able to feel the smear test, just take a Nurofen or 2 if that's what they prescribe. And just as you would if you were going for a waxing, maybe what that does is it kind of dulls the nerve endings. I'm not a medical person by any stretch, but I've heard that, so I believe it. So yeah, you can take that to just, or if you're really nervous about things like this and you already have access to medication, under the supervision of a doctor, obviously, then if you have Valium or something like that, then take it if you think that you need something like that to calm your nerves. Because things like the dentist and smear tests and things like that are not always a pleasant idea until you get your mindset around it. So if you make it up to being a big thing, it can feel like a really big thing. So, all you've got to do is get through it. And so if a little bit of medication helps you, then, that's maybe what you need to do. So anyway, back to the waiting room. You're called in by this really nice, gentle person who's a nurse and has done thousands of these things. And so follow her in. She'll just make you feel welcome. Take off the bottom half of your clothes. You lie on the medical couch, and then she will explain what she's going to do. You just lie there, be as relaxed as possible, follow her instructions, and I've just had one this morning, which is why I thought I wanted to talk about it, because I've been the most anxious, wimpy, squeamish person for as long as I can remember. And yet I came out of there thinking, I actually said to her, is it done yet? And she was like, yeah, all done. So I wanted to say that to put your mind at rest if you've had your letter, or if you need to make your appointment, because it really isn't a big deal at all. And I've done it, and I'm feeling really good about having done it and thinking, what was all the fuss about? But I do have a technique to teach you, which is why I want to do this video, because it's something that I've used now at the dentist and for my smear test. And I think that it might help you if you do something like that. So what I used to do was take along a little fruity sweet, and I'd hold the sweet, and then if I got nervous or felt sick or anything, I'd just take a little bite of the sweet, or just to, and sometimes because of anxiety I've done like heaving and stuff, never actually been sick there, but all that sort of stuff is all manifestations of our fear. So if we can get our fear into a box and feel kind of calm and confident about this, it really passes by with no trouble at all. So what I'm going to teach you is, I'm not in any of these things, I'm not a qualified practitioner. I'm just sharing with you what I've learned along the way and hope that it helps. So it's called EFT, which stands for Emotional Freedom Therapy, or Emotion freedom technique, something like that, and it's also known as tapping. And so basically there's ways to do tapping where, you know, you're tapping on certain points on your body, and I can't even remember what they are now. I think there was like the temples and the collarbone there, and then underneath just where your bra strap is, you just kind of tap. So, but we're not going to do that today because that's going to be a bit of a strange thing to do when the nurse is doing something and you start going like that. They might kind of think, what's she doing? Is she all right? Had I better stop? So what I'm going to show you is something very discreet that no one even really needs to know you're doing. But I did tell the nurse today in case she wanted to, I'm waffling now, aren't I? In case she wanted to tell other people who were nervous. So I'm going to stand up so you can see my hands. So you're going to, in fact I need glasses as well for this. Right, so what you do is, that is a pressure point there, which is used in, I can't remember what it's called now. Anyway, that is a pressure point, and that is a pressure point. That's a therapeutic sort of one. And when you get onto this finger, you press the other side for some reason, whether that's to keep your brain alert, so you're thinking about it. So what you can do is you just keep repeating this. So you press in the corner of your finger there, and round this side on that one, and back to there on that one. And you keep on doing it throughout the procedure. And it doesn't have to be for a smear test, it can be for any procedure that you're not, I mean, you can do it, you know, because you can just do this on your lap without anybody really seeing. It just looks like you're just, you know, fidgeting a little bit. And as you press, those pressure points are going to help you with dealing with it. And also I think it keeps you can feel, your feelings are also focused up on your hands. So you're not just feeling what's going on down further down your body. And the other thing is your mind, because you're thinking, well, I'm doing something positive here to help myself through this. So you're actually in control. Okay, so that's all you need to do, is just press those pressure points on your fingers, swap round on the other finger, and just, that's it. And then, so I hope your smear test goes really well, and then, you know, if there's anything that they need to do, then you get to that point next time and you can do the same sort of thing about any other appointments. I mean, I've had loads of colposcopy appointments and things like that, and really kind of felt very worked up about it all, and I'm still here, so hope that helps. And just get my little gadget to turn this video off. Thanks for watching.